autoimmune conditions. Autoimmune conditions are many, kind of like every joint, every organ, every system will have some name of an autoimmune condition or something or the other. Either it's going to be, for example, if you look at the gut issue, it's going to be Crohn's disease, ulcerative colitis, or some sort of an irritable bowel syndrome, which we put together as inflammatory bowel diseases. Then if you think about joints, it's going to be like rheumatoid arthritis, lupus, or some sort of ankylosing spondylitis. I'm just going to name the common ones. I'm pretty sure there are so many rare ones that are going to come into light right now. Like, every scientist, whenever they discover a syndrome, they're going to put a name in right next to it, and they're going to call it their own syndrome, like Sjogren's, they're going to call it Behçet's, or some other Graves' disease or Hashimoto's thyroiditis. So it's like, for example, if your thyroid gland is involved, then they're going to call it, depending upon if it's hyper or hypo, they're going to call it as hyperthyroidism, hypothyroidism. And if it is any other gland, for example, pancreas is involved, then they're going to call it as a type 1 diabetes when the pancreas, the insulin is not being secreted. If it involves any of the parotid glands or the salivary glands, then they're going to call it as a Sjogren's syndrome. So there are a number of different names that are given. For example, for the eye, it's going to be uveitis or some sort of optic neuritis. And for brain, then they're going to call it as some other thing like myasthenia gravis, some sort of an autoimmune vasculitis. They're going to put it as related to any other like vascular involvement, blood vessel involvement. So it's like few thousand names we can pull up from the internet related to autoimmune conditions. So allopathy has a wide range of diagnosis that is attached to or any kind of autoimmune conditions.